Hello and welcome to this Coaching Veterans presentation on cancer and VA disability claims, presented by me, Paul Bunn, with Veterans Outreach Ministries. Today we're talking about cancers that affect many veterans and how the VA recognizes them under disability law. We'll cover the full list of service-connected cancers tied to toxic exposure, including PACT Act presumptive cancers, Agent Orange presumptive cancers, burn pit-related cancers, and Gulf War-associated cancers. We'll also discuss cancers linked to industrial chemicals, radiation, contaminated water, and other hazards faced during service. You'll learn how the VA rates cancer by percentage, why active cancer is automatically rated at 100% for a period of time, and how residuals are rated after treatment. We will walk through how to service connect cancer through presumptive rules, documented exposure, direct evidence, and secondary conditions. By the end of this presentation, you'll understand how to document your diagnosis, prepare for your C&P exam, and build a strong VA disability claim for cancer and the long-term effects it has had on your life. Cancer develops when abnormal cells grow uncontrollably in the body. Veterans face increased cancer risks due to toxic exposures, radiation, burn pits, herbicides, contaminated water, industrial chemicals, and other hazards. Many cancers do not appear until years after service. Example, I didn't realize that the cancer I developed years later was linked to the burn pits I worked near during deployment. Veterans face several types of exposures that significantly increase cancer risk. These include burn pit smoke, diesel fumes, radiation sources, depleted uranium, chemical solvents, contaminated water, asbestos, industrial toxins, and herbicides like Agent Orange. Many veterans were exposed daily without proper protection. Example, my doctor said my exposure to heavy smoke and chemicals during deployment likely contributed to my cancer diagnosis. The PACT Act significantly expanded presumptive service connection for veterans exposed to burn pits and airborne hazards. Presumptive cancers include brain cancer, gastrointestinal cancer of any type, glioblastoma, head cancer of any type, kidney cancer, lymphatic cancers, neck cancer, lymphomas, melanoma, pancreatic cancer, reproductive cancers, respiratory cancers, and several other rare cancers. These cancers no longer require proof of causation if you served in qualifying locations. Example, my gastrointestinal cancer was automatically considered service-connected under the PACT Act because I served in Iraq near burn pits. Agent Orange exposure is also strongly linked to cancer. Presumptive cancers include soft tissue sarcoma, chronic B-cell leukemia, Hodgkin's disease, non-Hodgkin's lymphoma, multiple myeloma, prostate cancer, respiratory cancers, and some rare cancers involving the organs. Veterans who served in Vietnam, Thailand, Cambodia, Laos, Myanmar, Johnston Atoll, or Blue Water Navy are covered under these presumptives. Example, my prostate cancer was automatically accepted because of my documented Agent Orange exposure. Burn pit exposure has been linked to many cancers not previously recognized. The PACT Act now covers many of these as presumptive, including respiratory cancers, head, neck, and reproductive cancers, lymphomas, pancreatic cancer, and gastrointestinal cancers of any type. These toxic fires burned everything from plastics and fuels to medical waste and chemicals. Example, my respiratory cancer developed years after I worked by burn pits, and the VA recognized it as presumptive. Gulf War veterans are at higher risk for a variety of cancers due to oil well fires, chemical agents, vaccinations, pesticides, and environmental hazards. Many cancers fall under presumptive lists for Gulf War veterans, especially respiratory cancers and cancers linked to chronic inflammation. Example, my doctor said the constant smoke exposure from the oil fires contributed to the cancer I later developed. The VA rates cancer under 38 CFR depending on the body system involved, but the rule is the same. Any active cancer is automatically rated at 100%. This includes when the veteran is undergoing chemotherapy, radiation, immunotherapy, or surgery. The rating continues at 100% for at least 6 months after treatment ends. Example, I received a 100% rating while undergoing cancer treatment and during my recovery period. Once cancer goes into remission, the VA evaluates the lasting symptoms and functional loss caused by treatment. This includes scars, organ damage, fatigue, nerve damage, pain, digestive issues, and any long-term limitations. The new rating is based on the permanent residual effects, not the cancer itself. Example, even after remission, I was rated for nerve damage and fatigue caused by chemotherapy. Veterans can establish service connection through direct evidence, even if the cancer is not on a presumptive list. Direct service connection requires exposure documentation, medical evidence, and a doctor's opinion linking the cancer to service. This may include deployment records, MOS exposures, or contamination reports. Example, my rare cancer wasn't presumptive, but my oncologist confirmed it was related to my solvent exposure during service. Secondary service connection applies when a cancer is caused or worsened by another service-connected condition. Examples include liver cancer secondary to hepatitis, kidney cancer secondary to long-term hypertension medication, or cancer caused by immunosuppressive drugs prescribed for another service-connected condition. Example, my doctor linked my liver problems and later cancer to medication I was given for a service-connected autoimmune condition. Cancer can also cause a long list of secondary conditions. These may include depression, anxiety, neuropathy, chronic pain, heart issues, digestive conditions, respiratory problems, and severe fatigue. All of these may be separately rated. Example, the nerve damage from my chemotherapy became a second claim and helped increase my overall rating. Before your C&P exam, bring oncology notes, pathology reports, surgical records, and a timeline of your treatment. Be clear about all symptoms, including fatigue, pain, weakness, or complications from treatment. Example, I told the examiner that even simple tasks exhaust me due to the long-term effects of chemotherapy. Lay statements can significantly strengthen cancer claims. Spouses, family, or coworkers can describe changes in energy, behavior, mobility, and daily functioning. They can also support exposure claims. Example, my wife wrote that I lost weight rapidly and struggled to perform basic activities during cancer treatment. Keep a detailed record of cancer treatments, hospital visits, imaging, test results, and any secondary symptoms. Document how the cancer and its treatment limit work, daily tasks, and overall stamina. Example, I kept every medical report and tracked how often fatigue kept me from working or driving. Cancer is recognized under multiple sections of 38 CFR and may be service-connected through direct, secondary, or presumptive pathways, including the PACT Act, Agent Orange, burn pits, and Gulf War exposures. If you have a cancer diagnosis, do not assume it is not service-connected. Gather evidence, document limitations, and be honest about your symptoms. For help and support, visit www.vetcenters.org or call 1-888-833-01942. You've served your country. Now it's our turn to serve you.